Hello everyone, this video is all about mental health. May this add up to your knowledge about mental health, and also may this be a help to others who are suffering from mental health issues. Here are the points we will tackle about in this video. First one is the definition of mental health, its history, some types and symptoms and its causes, its treatment, ways to prevent mental illness and disorder, its effects and impacts, and data about mental health worldwide.
What is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adulthood. Mental health is often used as a substitute for mental health conditions such as depression, anxiety conditions, and others. According to the World Health Organization, however, mental health is a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses in life, can work productively and fruitfully, and is able to make contribution to her or his community.
History of mental illness. Throughout history, there have been three general theories of the etiology of mental illness. First is the supernatural. Supernatural theories attribute mental illness to possession by evil or demonic spirit, displeasure of gods, eclipses, planetary gravitation, curses, and sins. Somatogenic. Somatogenic theory identify disturbances in physical functioning resulting from either illness, genetic inheritance, or brain damage or imbalance. Psychogenic. Psychogenic theories focus on traumatic or stressful experiences, maladaptive learned associations, and cognitions or distorted perceptions.
Here are some types of mental illnesses and disorder. The first one is anxiety disorder. It is a feeling of fear, dread, or uneasiness. It may cause you to sweat, feel restless, and tense. It can be normal reaction to stress sometimes. Anxiety disorder is one of the very common mental disorders in the world, but sadly it is being neglected. The second one is panic disorders. It is a type of anxiety disorder. It causes panic attacks, which are sudden feeling of terror even when there is no real danger. You may feel as if you are losing control. Panic disorder is a type of anxiety disorder because you feel fear. Next one is obsessive compulsive disorder. It is a mental disorder in which you have thoughts or obsessions and rituals or compulsions over and over. They interfere with your life but you cannot control or stop it. OCD can be very harmful not only to the person who is suffering from it but also to the people who surrounds him or her. The next one is phobias. It is a type of anxiety disorder. It is a strong irrational fear of something that possesses little or no real danger. Yes, phobia is a mental disorder. And it is a type of anxiety disorder because it feels fear. To be exact, irrational fear. Here are some types of phobias. Acrophobia, fear of heights. Trypophobia, fear of many small holes. Agoraphobia, fear of public places. And claustrophobia, fear of closed-in spaces or dark and narrow spaces. The next one is depression. It is a serious mental illness. It's more than just a feeling of being sad or blue for a few days. They persist and interfere with your life. As it is said, it is a very serious mental illness. Actually, it is the very common mental illness in the world, but sadly, again, it is being neglected because they think it is not serious enough. The next one is bipolar disorder. It is also a serious mental illness. People who have it go through unusual mood changes. They can go from very happy or up and active to very sad and hopeless or down. They often have normal moods in between. The up feeling is called mania. It is the hyper mood of the person who's suffering from bipolar disorder. And the down feeling is called depression. It is the very sad mood of the person who has bipolar disorder. The next one is post-traumatic stress disorder. It is a mental health disorder that some people develop after they experience or see a traumatic event. Sometimes the event is not necessarily a dangerous one. But even if it is not dangerous, it causes trauma to the person who experienced it, and eventually they will carry it until they get old. And next one is psychotic disorder. People with psychosis lose touch with reality. Psychotic disorders are severe mental disorders that cause abnormal thinking and perceptions. Schizophrenia is one type of psychotic disorder. As it said, the person can lose touch with reality and can have abnormal thinking and perception.
Mental illnesses such as depression and anxiety can cause stress and long-lasting sadness. Think of this way. You feel like being caged in an unending dark voices, as though voices tempting you to end your life. As the time passes by, you feel like losing interest in your future, always being guilt of why do you live in this world. That's how it feels to have depression and anxiety. These mental illnesses are pretty hard to deal with when it becomes the part of your childhood. Psychotic disorders such as schizophrenia can cause hallucinations, delusions, and suspiciousness. These mental illnesses feels like seeing imaginary people. They usually interact like a normal person, but they are actually your imaginations. These illnesses can also make you having trouble in sleeping. Phobias can also have difficulties on breathing and rapid heartbeat. Having mental illnesses like phobias are having a fear on something, but they can be really dangerous because of the panic that you really feel to that fear. It causes rapid heartbeat and difficulties on breathing. Panic disorder can cause nausea, numbness, and chest pain. Panic disorder is usually common in women. This usually occurs when we are going through our adulthood. The panic disorder attacks unexpectedly, sometimes when we wake up from our sleep. OCD or obsessive compulsive disorder causes obsessive thought and compulsive behavior. People with this mental disorder cannot control their obsessive thoughts and behavior, and they feel like urge to do those thoughts. These mental illnesses can also cause anxiety. PTSD or post-traumatic stress disorder can cause avoidance and changes in physical and emotional reactions. According to some researches, people with PTSD or post-traumatic stress disorder have intense, disturbing thoughts and feelings related to their experience that last long after that traumatic event has ended. Because of their past, they usually always think of their flashbacks and their distressing dreams. These mental illnesses can also cause avoidance in things because of their traumatic events that happened in their past.
What is the cause of mental health? Mental illness can cause a people to have a depression, and it happens due to a mix of emotion that including in genetics problem with the family, in how our brain works regularly and how we grow up, and how to face our problem that can cause into a depression, and we can have a healthy lifestyle. Example of mental cause is childhood abuse or trauma, social isolation or loneliness, experiencing discrimination and stigma, social disadvantage or poverty, losing someone that close to you, severe or long-term stress.
The treatment depends on what type of mental illness you have, its severity, and what works best for you. In many cases, a combination of treatments work best. Psychotherapy is the therapeutic treatment of mental illness provided by a trained mental health professional. Psychotherapy explores thoughts, feelings, and behaviors and seeks to improve an individual's well-being. There are classes of psychiatric medications that are commonly used. They are antidepressants, anti-anxiety, mood stabilizing, and antipsychotic medications.
There is no accurate way to prevent mental illnesses and disorders, but there is a way to control them. Increasing your resilience and boosting your self-esteem can reduce or prevent few of the mental illnesses, such as depression and anxiety. Valuing yourself can be also helpful to somehow reduce your mental health disorders by treating yourself with kindness and respect. Making time for your hobbies and doing some amazing things like hiking and exploring the world can be also helpful to your mental health. You can also lessen the occurrence of mental disorders by doing exercise and a healthy lifestyle. Doing exercises can also improve your mood, which helps to reduce your mental health disorders occurrence. Getting enough sleep could help you improve physically and mentally. Meditating could also help improve your state of mind. Consult to psychiatrists or psychologists so that you can get an advice on reducing or preventing mental illnesses or disorders. Seeking help is a sign of strength, not a weakness. And it is important to remember that treatment is effective. People who get appropriate care can recover from mental illnesses and addiction and lead full, rewarding lives.
Effects and impacts of mental health illness. In individual, people with mental health problems are more likely to experience distress, discrimination, marginalization, and problems with their employment, their finance, their relationships with family and friends, their physical health, and their ability to live a productive and satisfying life. Engage in participating fully in the multiple facets of the thriving urban community. In family, mental health issues can be an extremely painful and traumatic time for all of the family and have a huge impact on a family's financial and emotional components. When it comes to mental illness, the emotional and behavioral consequences for family members go largely ignored. It is clear that individuals' mental health problems have consequences for others within their social networks, most notably their family. In community, stigma and discrimination can also worsen someone's mental health problems and delay or impede their getting help and treatment and their recovery. Social isolation, poor housing, unemployment, and poverty are all linked to mental health illness. So stigma and discrimination can trap people in a cycle of illness.
As it said by Dr. Gro Harlem Brundtland, Director General of World Health Organization, mental illness is not a personal failure. In fact, if there is a failure, it is to be found in the way we responded to people with mental and brain disorder. So here are some data about mental health worldwide. In 2017, this is the estimated people who have lived with mental health disorder. This is slightly more than 1 in every 10 person globally. So it is 10.7% or 792 million people who is suffering from mental health disorder. Now, 1 in every 4 people in the world who suffers from mental health illness or disorder this 2020. Maybe it is because by the pandemic we are facing right now. Here are some other facts. Countries who don't have mental health policy is 40%. Countries who don't have mental health program is 30%. And countries who don't have mental health legislation is 25%. So in short, Mental health is not prioritized by many of these countries around the world. Maybe there is, but it is being ignored most of the time. So to conclude, mental health is important. So please take care of your mental health even in the simplest way you know. As we leave this quotes to you, you are more than your illness and you are not alone. If you know someone who is suffering from mental health disorders or illness, please call these numbers. It is the Hope Hotline, a mental health association in the Philippines. Thank you for listening to this video. Hope you enjoyed and help you a lot.